Hurrah for technology, ology, ology, oh. Glorious old technology, ology, ology, oh.
Hello, and thanks for joining. I'm Pooja Shukla Devendran, class of 1999, course 7. Though McCormick was my home on campus, and I miss the East Coast snow, I call Northern California home now. I am the founder of a startup that builds therapeutic virtual windows for hospitals and interior offices. Welcome, everyone.
Hi, I'm Mel Iverson, class of 2019, Executive MBA. I come from the UK and live in Boston. I'm the Chief Development Officer at Moderna, where we develop vaccines against COVID-19.
Guten Tag und willkommen. My name is Babak Morasagi, class of 2014, course 15. MIT encouraged me to change the world for the better, which I try to do by founding a telehealth company as an entrepreneur.
Hello, my name is Laura Fayad. I'm a musculoskeletal radiologist at Johns Hopkins University in Baltimore, Maryland.
Hi, I'm Dr. Dewana White-Satcher, class of 1986, course 10. While at MIT, I lived in McCormick, but I now live in Houston. I'm an academic pediatrician, and I serve as a COVID-19 vaccine ambassador at my hospital. Welcome.
Hi everyone, I'm Tang Vota, class of 1998, course 15. I run a startup here in London that's invented a completely new type of tampon called the Tampliner. It's fantastic to have you here.
Hello, I'm Brian Carty, class of 1985, courses 10 and 7A, former resident of Next House and an alumnus of the MIT Logarithms. I'm a family physician in Alexandria, Virginia, near our nation's capital. Welcome.
Hi everyone, my name is Janice Tan, SMO3, course 2. I'm originally from Penang, Malaysia, but I've been living and working in Singapore for a while in the healthcare sector, working in hospitals, but most recently in nursing homes, particularly taking care of the elderly against the COVID virus.
Hi, I'm Joe Sorello, graduating class of 2001 in course 9, and I'm the current Global Marketing Director at WebMD Medscape, helping to keep the healthcare professional community informed about all things related to the coronavirus.
Hi there, I'm Yu-Chen Feng, course 6-3, class of 2013. These days I live in Princeton, New Jersey, and spend my time building digital health products and birdwatching. Welcome and take care.
I am Richard Bryan, class of 67, course 6-2. I'm the CEO of a Florida nonprofit that is working pro bono on a public health effort that will add years of healthy life to tens of millions of people in the U.S.
Hi, my name is Sri Koka. I'm a Sloan graduate, the Executive MBA program, class of 2013. I'm a dentist. I currently live in San Diego, California, and will soon be moving to Jackson, Mississippi. And I'm very excited to welcome you to this Innovations in Healthcare event.
Good evening, and thank you to the MIT healthcare leaders from across the world for that warm welcome to kick off this virtual campaign roadshow event. We cannot be together in person because of the pandemic, of course, which makes the theme of tonight's event, Innovations in Human Health, particularly fitting. Fitting, but not new. MIT's work to understand and improve human health spans decades and covers the Institute. 10 major centers are devoted to health research. The current faculty includes 3 Nobel Prize-winning members in medicine and 16 Howard Hughes Medical Institute investigators. In total, more than a third of the faculty, representing every department at MIT, engage in research directly related to health science and innovation. They study basic biological processes, pioneer genomic tools, design medical devices, invent novel materials with applications ranging from improved protective equipment to the targeted delivery of medicine, peer into the mysteries of the brain and combat diseases of aging, design healthy buildings and communities, improve the management of hospitals, and explain the economics and politics of policy decisions. In the new MIT Schwarzman College of Computing, as you'll hear tonight from Dan Huttenlocher, health is at center stage. There, researchers are using machine learning, natural language processing, computer vision, and other AI tools to discover new drugs, find alternative uses for existing medicines, and cost-effective ways to produce these therapeutics, to interpret mammograms and other imagery detecting early-stage cancers, to interpret and secure securely combined libraries of records across healthcare providers, enabling new insights and inferences, to develop real-time non-invasive monitoring devices, and to leverage big data at scales ranging from personalized medicine to tracking the spread of disease nationally and globally. Serving as the hub of the densest innovation cluster in the world, MIT is nimble and inventive, particularly when it comes to the life sciences. We don't have a medical school or a hospital, but there are excellent ones nearby with whom we happily collaborate. At the Engine, a tough tech incubator launched by MIT, a third of the startups focus on biotech. As the threat of COVID-19 became clear, hundreds of faculty and students across the Institute, in disciplines ranging from biology and chemistry to design and mechanical engineering, to economics and management, they responded by forming teams to meet the challenge, remixing their skills to develop new equipment, testing methods, triage strategies, therapies, and a fundamental understanding of the virus and its mechanisms. President Reif reminds us that we are a community with, quote, a passion for tackling humanity's hardest problems together, end quote. A crisis like that posed by COVID-19 is a moment for MIT to demonstrate that ethos. An appreciation for both intellectual understanding, or MENS if you prefer, and the practical application of that knowledge in the world, or MANUS, that's baked into who we are and explains MIT's response to COVID-19. We do not shy away from the tough problems, as daunting as they appear. We seek to know more and to turn that knowledge into know-how. It is our mission, and we are proud to be mission-driven. Like that of any great research university, MIT's mission directs us to educate students and advance knowledge. When MIT faculty pursue this mission, they change the way we look at the world, they launch disruptive new industries, and they help shape, support, and educate astounding students. This work is vital, but unlike most other schools, our mission statement does not stop there. It calls for MIT to educate students and advance knowledge, not just for their own sake, but, quote, to serve the nation and the world for the betterment of humankind, end quote. It demands that we use our knowledge to tackle humanity's greatest global challenges. We embrace these obstacles because we know that the people of MIT can deliver and make a better world. To support that dream, in May of 2016, we launched the MIT Campaign for a Better World, a campaign aimed at bringing the most talented faculty and students to MIT and empowering them to accomplish that mission. Many of you have told us that your generosity to MIT has a simple inspiration. You have seen that a gift to MIT is truly a gift to the world. What makes this true is that to the people of MIT, humanity's urgent challenges are invitations to action. From our unwavering commitment to scientific discovery, to our zest for innovation and collaboration across disciplines, MIT is turning promising theories into practical solutions. We are focused on ensuring that everyone in the world can benefit from the insights into the natural world, from new ways to educate on campus and beyond, from clean water and clean energy, from computational innovations and nanomaterials, and from improved healthcare and increased access to life-saving treatments and technologies. Our objectives for MIT are bold. We aspire to create the next generation of highly trained thinkers and doers who will offer the world both technological proficiency and the cultural, ethical, and historical consciousness to use technology for the common good. Providing them with the resources to do their best work will take the dedication, participation, and support of MIT's alumni and friends. The MIT community has come together, and we are nearing the completion of the $6 billion MIT Campaign for a Better World, thanks to more than 110,000 donors around the globe. Many of you with us tonight have lent your support already, and there's still time for everyone to participate in this momentum effort, and we hope you do. On behalf of MIT and President Reif, I say thank you to all of you. Now, later this evening, you'll have the opportunity to join breakout sessions with MIT faculty and staff who will share research highlights and news from across the Institute. You can find information about all of the breakout sessions, including the Q&A following this plenary session, on the event website. But first, you'll hear from 3 MIT scholars who will discuss their work and then join me in a panel discussion of questions you submit. Our speakers will be Mariana Arcaya, Associate Professor of Urban Planning and Public Health and Associate Department Head in Urban Studies and Planning. Steven Truong, a 2020 graduate who double majored in Biological Engineering, or Course 20, and Creative Writing, or Course 21W, and who is currently a Marshall Scholar. And to get us started, Dan Huttenlocher, the inaugural Dean of the MIT Stephen A. Schwarzman College of Computing, and the Henry Ellis Warren 1894 Professor of Electrical Engineering and Computer Science. Dan, over to you.
When you think of AI, you probably think of humanoid robots from science fiction. But I'd guess that today many of you have spoken with Alexa or Google Assistant or Siri, and you'd pretty much immediately recognize that as being AI. But you also might have been diagnosed or prescribed medication today because of AI. You might have had no trouble buying toilet paper at the grocery store because of AI. You might have avoided the traffic today because of AI. The AI that affects our lives is often not visible to us. You're depending on it and you don't even know it. I'm Dan Huttenlocher, and I'm the inaugural Dean of the MIT Schwarzman College of Computing. When we talk about AI today, we're also talking about machine learning. Think about it this way. AI refers to the intelligent-seeming behavior of a system, while machine learning is a technology that enables AI. AI work has been going on since the 1950s, but the last decade has seen huge advancements. That's because of powerful new machine learning methods, and also because of large increases in the amount of data available for training machine learning. When people are equipped with knowledge about computing and AI, in addition to their field of expertise, they can go out and make things happen at an unprecedented rate. People who are educated this way are what President Reif calls computing bilinguals. They're the type of students we're here to educate at the Schwarzman College of Computing, and the type of researchers whose work we're here to advance. To be bilingual in this way, you need to know the language of computing and AI as well as the language of the domain you're using it in. MIT is the natural place to be at the forefront of this transformation. AI in health and in scientific discovery are active areas for us. That includes individual projects and bigger organizational parts of the college, such as the Jamil Clinic, where the entire mission is focused on machine learning in health and on tying fundamental research to clinical outcomes. While the COVID-19 pandemic has belatedly focused necessary attention on the huge societal consequences of novel viral infections, other looming public health crises similarly pose urgent needs for new treatments. A particularly concerning one is bacterial infections. Today's antibiotics are becoming less and less effective because bacteria are evolving to become more resistant to them. This evolution is happening at a frightening rate, rendering not only existing, but even new antibiotics ineffective because of their similarity to existing ones. The challenge has been the difficulty of finding new antibiotics that are significantly different from the ones we have, and thus are effective against drug-resistant bacteria. In the Jamil Clinic, professors Jim Collins and Regina Barzilay have been able to identify an antibiotic candidate that's extremely effective against drug-resistant bacteria in the lab, as was announced about a year ago. Machine learning plays a critical role in this important discovery, and perhaps even more importantly, holds great promise for other discoveries. To find new antibiotics, there are so many possibilities that it's not practical to try even a small fraction of them. So one must somehow identify promising candidates. This is where machine learning comes in. Jim and Regina developed new machine learning methods to radically improve this discovery process. The particular antibiotic candidate they've identified has been proven in the lab, and that still leaves a large amount to do before it could be shown to be something safe and effective in people. But even at this stage, it's a major advancement, a surprise even, because of how hard it has been to identify potential antibiotics that are effective against drug-resistant bacteria. As important as it is to have effective antibiotics, AI is increasingly used in discovering other important and surprising things. And I find that the word surprise is very useful here. We're beginning to see what amounts to AI and human collaboration in scientific discovery. We've thought of AI as another computing tool, but to me, a tool doesn't really surprise you when you're using it. A collaborator surprises you. Positive surprise is something like the discovery of a new antibiotic candidate, but surprise can be negative as well. And understanding and refining possible negative outcomes of machine learning is an important goal of the college. The function of AI depends on data you train it on, which in some ways isn't all that different from humans, whose behavior can depend a lot on what they are taught. We all can agree as a society that we've got to do better at training and testing AI more broadly and deeply, no matter what its function, to help prevent outcomes such as bias or discrimination. These problems are not unique to AI. Pulse oximeters, those little things that go on the end of your finger to monitor your blood oxygen levels, are an example of a tool developed decades ago with a potentially fatal such problem. It turns out that their accuracy is lower for darker-skinned people than lighter-skinned ones. But if we are coming to rely on AI as more than a tool, then it is also all the more important that it does not succumb to such problems. We need AI to be well taught. So to me, the really exciting broader question about AI and machine learning is this: in what ways is it more than a tool? How can you say it's a tool when it's leading to such life-changing discoveries in areas that have already been heavily studied by people? These are areas that experts have been looking at using powerful tools for a long time. And yet AI and machine learning are producing surprising results. And that's why it's so hard to begin to understand or even to name the relationship between people and AI. The fact that we're wrestling with what you should even call something is compelling. It's impossible to think of Siri or Alexa as a collaborator, at least today. It's even hard to think of that interaction as a conversation. So is it that scientific discovery is an exception, or is AI soon going to surprise us with results in many areas, like a smart colleague might? So you can see all of this is new, puzzling, and changing quickly. And speed matters, not just so we stay at the forefront of AI and machine learning fundamentals, but AI applications are developing fast, and we need them to, especially in terms of healthcare. And back to this notion of computing bilinguals. It's not just about helping AI and computer science experts understand the new world. You have to help people in other areas understand it too. To get the most positive benefit and minimize possible negative outcomes, we need collective understanding. If you're an expert in computer science, for example, you probably aren't an expert in economics or philosophy or marketing, so you don't understand those kinds of outcomes. And vice versa for the economist, philosopher, or marketer. And it's for this exact reason we're educating computing bilinguals. We're helping students and researchers combine computer science and other disciplines in addressing the world's hardest problems, those that people have not been able to solve alone, and at the same time, attending to possible unanticipated consequences of such solutions. It's in MIT's DNA to lead in thinking and doing. Truly integrating computing across MIT, that's how we'll take unparalleled leaps in making a better world.
A year ago, many of us had never heard the term COVID-19. In fact, it wasn't until February 11th, 2020 that the World Health Organization announced that the disease caused by the 2019 novel coronavirus even had the official name COVID-19. The sudden, pervasive impacts of this brand new virus, so new it even had the word novel in its name, has tragically killed over 2 million people in just a year and has turned every aspect of our lives upside down. We've heard from the media and government that we are living through something truly exceptional, even unprecedented, that we still barely understand COVID-19, which is true. But in another sense, we understand COVID-19 extremely well, too well, I would argue. Without knowing exactly what this disease was, how it spread, or what its exact effects were, everyone could guess who would suffer first and most. I'm Mariana Arcaya, an associate professor of urban planning and public health at MIT. As a social epidemiologist, I study population-level patterns of health and disease. What social epidemiologists know, based on centuries of data collected across the globe on hundreds of health outcomes, is that low socioeconomic status, exposure to racism, lack of power, and other forms of social marginalization are fundamental causes of disease. For any disease you can think of, there's a unique set of factors that put people at risk of developing that disease. But fundamental causes of disease are factors that cause lots of diseases and put people at risk of lots of health risks. That means it doesn't really matter what the disease is or exactly how it spreads. Socially vulnerable people are going to be at elevated risk practically every time. At MIT, I run a participatory action research study in collaboration with the Conservation Law Foundation, local community-based organizations, and residents. Together, we understand how different aspects of neighborhood environments create health risks and what we should do about them. Here are some pictures of my MIT students going out with community-based resident researchers to collect data in the field. In typical research, academics think of a hypothesis on their own and then check to see if the data support it. Participatory action research turns this model on its head. First, we work hand in hand with affected communities, people with lived experience of the issues we're studying, to understand their perspective on the challenge and what we need to do to solve it. And then we check to see if the data supports their hypotheses. We know that the residents of our study communities are the experts in understanding what they need in their communities to be healthy and what's putting their health at risk. By asking and answering a question, this is only the first step. We use the results of our research to work together to try to affect change based on our findings. So when COVID-19 hit, we built on 5 years of partnership researching community-level determinants of health, and we put our model into action. In March, when there were less than 1,000 cases of COVID registered in the state, we knew from our research and our partners' lived experience that our study communities, such as Chelsea, Brockton, Lynn, and Everett, were bound to face disproportionate COVID risk due to unfair social inequities in economic, social, transportation, and housing conditions. Unfortunately, but predictably, we were right about the rates. And we saw that by summertime, the municipalities I just named were among the most highly affected places in Massachusetts. But being researchers, it wasn't enough to know where the cases were. We wanted to rigorously understand what mechanisms were creating the excess risk that we knew would be there, and to help advocates and policymakers address these risks to improve conditions for health. Our first step in getting to the mechanisms was to really listen to what residents of our study communities said in their own words about the risks and challenges they faced in their daily lives. Qualitative data from our study pointed to housing costs as a key theme. Residents in Chelsea, the Massachusetts city with one of the highest COVID-19 case rates, raised housing costs as a serious problem. One resident in our study told us, "There's a lot of people in Chelsea that are renting out rooms in houses because they can't afford the rent." Another respondent, a 50-year-old woman working 2 part-time jobs, one in a school and one in a supermarket, has been renting one of these rooms in Chelsea for 3 years. "I live with 5 people that I'm not related to," she said. A homeless respondent from Brockton, another highly affected city, says housing costs prevent him from getting off the streets, telling us, "And my biggest concern myself is I'm homeless here. I want to move somewhere where the housing is a little cheaper, but because I couldn't afford, not on my own anyways, I've stayed at a few relatives' houses and then at a homeless shelter up the street. So that's about 5-6 places. I paid them rent, or I tried to. I tried to give them what I could." So learning from residents was the first step. And the next step was following the leads these residents gave us to investigate patterns in the Massachusetts COVID data set. We used the official state database on infection rate, which many universities are using in COVID research, but we combined it with data on housing market trends to predict disease spread, something the other researchers had not done. And what we found matched up well with what residents were telling us, that their housing costs were so unaffordable and going up so fast that they were living in unstable or overcrowded housing, conditions that we now recognize as COVID risk factors. So take a look at this. Here's a map of Massachusetts with each municipality colored according to COVID-19 case rates as of this summer, which is when we completed this analysis. The darker the color, the higher the share of people who had gotten COVID. And when we add an outline showing the places that have seen the highest percent increases in housing values over the past 5 years, we see a close correspondence with the places suffering high COVID rates. When we test this relationship statistically, we find that on top of other factors that have been used to predict COVID case rates, for example, local poverty rates, density, employment and work from home jobs, and other factors, housing market factors still matter. We see that rapidly increasing home values, especially in places that have until recently been affordable, is an independent risk factor for COVID spread. This housing market dynamic, rapidly increasing housing values in previously affordable neighborhoods, is generally what people talk about when they're talking about gentrification. This research helps show the importance of policies that protect access to affordable housing for health and supports local advocates in their fights for housing justice. You can only do this kind of participatory work in a place that values community partnership and understands that putting residents at the center of place-based research improves social science. Participatory action research is just one of the ways that my students at MIT are helping to make a better world.
We all inherit characteristics from our parents, good or bad, be it black hair that hopefully doesn't disappear with age, brown eyes, or essentially almost any trait you can think of. I'm Steven Truong, and I'm part of the MIT class of 2020. Currently, I'm studying at Cambridge University. As you can tell, I have black hair, brown eyes, and hopefully I don't develop male pattern baldness later in life. Now, from the healthcare side of things, knowing what you've inherited is clearly important. Maybe your parents passed on to you a certain disease or predisposition to a disease. This is why genetics is a well-established and continually growing field of research. It can help us figure out what you might have and how we might go about treating it. One of the most well-known examples of a genetically linked disease is diabetes. In the United States, about 1 in 10 people have type 2 diabetes. You probably are close with someone who has it. Now, when we talk about diabetes, we jump into this big debate of nature versus nurture. Nature, which is your genetics, plays a role in that, but other factors in your environment, i.e. nurture, your income, your education level, there are so many factors that can influence your likelihood of type 2 diabetes. One study, for example, showed that poorer US counties have more than twice the obesity rate compared to wealthier counties. And as you probably know, obesity leads to a really high likelihood of developing diabetes. In fact, it's probably our best predictor of whether you have diabetes right now. So much so that very often diabetes and obesity are somewhat synonymous. But that's a problem, and here's why. Asian people like myself have this trait where we can look quite lean but have type 2 diabetes. This is why we're 3 times more likely to have undiagnosed diabetes than our white counterparts. It turns out that Asian people develop diabetes at much lower BMIs and body fat percentages than their white counterparts. My dad was a perfect example of this. He was a pretty lean person, and he'd go to the doctor confused as to why he was always so thirsty and lightheaded. So because he didn't look like the typical American with diabetes, the doctors didn't test him for it. So he was diagnosed so late in his disease that his body had already been seriously damaged. This question of why do Asian people develop diabetes, even though we're lean, has intrigued me ever since I was little. When I was a kid, my dad would always tell me, be careful of the carbs. And if you have any clue about Asian culture, though, you know how crazily difficult it is to avoid the carbs. We have rice for breakfast and rice for lunch and rice for dinner, plus other stuff we probably shouldn't. But being careful and being proactive isn't always enough, though. It really isn't. My father, despite basically cutting out most of the carbs in his diet, despite being really thin, passed away due to his diabetes complications not too long ago. I came to MIT wanting to study type 2 diabetes to figure out why, by virtue of just being born Asian, I had to be careful of how much rice I could eat. I also did it for my father. And I'd say that passion still lives in me today because that's the only thing I really want to study now. One thing I did at MIT was to look directly into this issue. Without any real expectations, I applied for a research grant called the Eleranza Fellowship. And what do you know? They said, yes, go ahead and see what you can discover. With the help of a very driven group of doctors in Ho Chi Minh City, I used the grant to start a study investigating the genetic basis of type 2 diabetes in Vietnamese people. Basically, we recruited patients at the hospital in Ho Chi Minh City and collected their DNA. With their DNA, now we can determine what genetic factors might predispose them to type 2 diabetes. But because our study is relatively small, we are limited in what it can conclude. However, we found a variant on one gene that regulates fat metabolism that may predispose Vietnamese people to type 2 diabetes. We're about to publish these findings, actually. More importantly, though, this study has opened up the door for future studies. In fact, several months ago, we officially secured funding from the National Foundation for Science, Technology, and Development of Vietnam. And now we can do an even larger study on the DNA we already have. In fact, we're hoping to expand our small-scale study into what's called a genome-wide association study, or GWAS. With a GWAS, we can look at the entire genome. In our study right now, we've only been able to look at one relatively tiny part of the genome. And for a complex disease like diabetes, you have to look at all these little sections and add them up to see what's going on. These GWAS studies have tremendous potential. In fact, using the resources of a particular dataset called the UK Biobank, scientists have been able to make amazing predictions. For example, scientists have been able to predict height within roughly an inch. They can even somewhat predict risk for breast cancer. One big caveat with this, though. We haven't been able to make good predictions with complex diseases like diabetes, where so many genes and so many environmental factors play a role. And of course, that's what matters to me. There's also a huge problem with these predictions. As with any algorithm, predictions will only be as good as the data you feed into them. And the fact is, the UK Biobank dataset is composed of about 95% of white individuals and 5% of every other racial group. This selection wasn't intentional. It just represents the demographic breakdown of the UK as it currently is. And this isn't to say that the UK Biobank isn't successful in some regards. It's given us so much insight, but like any study, it had its limitations. So in other words, these algorithms can make great predictions if you're white and British, but if you belong to any other group, well, kind of tough luck. Here's why this matters more than you might think, though. In the United States, African Americans are twice as likely to develop type 2 diabetes compared to their white counterparts. And this racial disparity is widening. Why is this the case? Why do minorities in general in the United States develop diabetes so much more often? We can't possibly ask these algorithms to figure out why when we aren't giving them the right data. Now, with a little MIT funding, I was able to kickstart something in Vietnam. Hopefully, it not only sheds a little light onto these questions, but also brings more awareness to this issue of representation in general. I hope you uplift those underrepresented in whatever fields you represent, because if this talk has any message, it's that a little can go a long way. A little can really make a better world. Thank you for listening.
Thank you, Steven, Mariana, and Dan. Your work is inspiring. From meeting the potential of AI to advance all disciplines, to understanding and planning for a healthy built environment, to finding new ways to combat diabetes, the work we heard about tonight embodies the MIT commitment to curiosity and discovery in the pursuit of a better, healthier world. To everyone who joined us, I hope you learned as much as I did. And I hope you will stay with us after a short break as we move into the next section of our program this evening, a series of concurrent breakout sessions. I invite you to return to the event page and follow the links to join the breakout sessions of your choice. Thank you again, and we hope to see you at our next event in March, where we will explore the topic of sustainability. Good night. So thank you, Mariana, Steven, Dan, for joining me. And thank you to everybody in the audience, to all of you for your questions. Thank you in advance. Before we begin, I want to take a moment to congratulate everyone from MIT who was involved in the Perseverance rover landing on Mars earlier today. And now on to our Q&A with our great speakers from tonight. I'm going to ask a couple of questions to start the discussion, and then we will field questions from the audience. To submit your questions, please use the Q&A button that you'll see at the bottom of the screen. So to Dan, Mariana, and Steven, we're all MIT graduates, so I thought I'd ask each of you to reflect on something related to that. What surprised you when you first arrived on campus? What was different from what you expected of MIT? And I'm going to start. I'm not normally going to answer questions. When I showed up in 1975, MIT had a reputation of being a cold, hyper-aggressive, unfriendly place filled with people with no social skills. And I'm sure you all know the joke from that days. How do you tell a really friendly MIT student? He looks at your shoes, not his shoes, when he talks to you, and you all laugh because you think it's funny. And I discovered that was completely wrong. People at MIT were friendly, curious about what you were doing, collaborative, really wanted to interact with people. And that's still true today. And I think that's one of the things I loved about MIT when I arrived. Dan, I'm sorry, we're going to do this generationally. So you're the next one to arrive at MIT. What surprised you most?
I think what surprised me most, and as you know, it was many decades ago, showing up at what was then the AI lab, was the really amazing problem-solving orientation of the faculty, of the students, of the researchers. It was a big shift from my undergraduate education. People really just wanted to dive in and solve the problems that were at hand, and we're standing around brainstorming at the whiteboards. And maybe I'll offer another comment beyond what you asked, which is I just came back to MIT about a year and a half ago after 3 decades away. And once again, I was really surprised by the problem-solving orientation on the MIT campus. So, you learn the same lessons over and over again, but it is a really incredible thing about the MIT community.
Thanks, Dan. That's great. Mariana, what surprised you most when you arrived?
My answer is actually very related to Dan's answer. For me, I think it was the optimism. I felt like if all of these incredibly brilliant people have these really deep understandings of huge, daunting problems, they're going to be despairing. And it was quite the opposite. I was really overjoyed to see that the deep understanding of the problems was leading towards a solution-oriented posture of, we can do something about this, no matter how big the problem. So the optimism was what struck me when I first got to MIT.
If I can, Mariana, that sounds so much like what President Reif says, right? That challenges to everybody else at MIT are opportunities to just dive in and tackle them. And I love that expression about the optimism. Steven, what surprised you most when you arrived on MIT's campus?
I guess for me, it was how talented everyone was in basically everything. And what upset me so much was that they weren't even arrogant about it, so I couldn't even get angry at them. Like, they could never take a compliment, for example. And for that reason, I think it really kind of pushed me out of my comfort zone. I was just kind of this antisocial high schooler who had no clue that I'd be going to a school where people were also just incredibly friendly and probably had the warmest faces in the world. And yeah, it really helped me grow. And it was a very humbling experience just all across the board.
Steven, I love it, especially your comment about, it's annoying that they weren't arrogant about it, because how can you get mad? But I love that point. All right, on to some more, not that wasn't fun and serious, some more serious ones. So to Mariana and Steven, each of you, or you each mentioned that you've published your recent research, and a number of our viewers want to know where they can find it. So what journal should they consult for things in your space? And Mariana, I'll start with you and then we'll go to Steven. Where should they look?
Yeah, thanks for that question. The paper, the study I spoke about tonight was published in a journal called Social Science and Medicine. And so that paper can be found under the title Rising Home Values and COVID-19 Case Rates in Massachusetts.
Great, thank you. And Steven?
Because my exact work, it hasn't been published yet, but keep an eye out for it. It'll be out there soon enough. But feel free, I guess, since this is the age of social media, I will be gladly happy to update everyone at Steven D. Truong.
Perfect. Great. Dan, for you, the Jameel Clinic's work on using machine learning to identify antibiotics to treat drug-resistant bacteria is fascinating. It's one of my favorite examples of just using machine learning AI to solve really interesting problems. Have they applied that know-how to treatments for COVID-19?
Yeah, so that's in general at MIT, early in the COVID pandemic, many parts of the Institute looked at redirecting research toward solutions for COVID-19. And the Jameel Clinic was not alone in that. There's actually a site called aicures.mit.edu, which is run by the Jameel Clinic, that brings together a number of the machine learning research projects that have been done under the auspices of Jameel Clinic, aimed specifically at COVID-19. And in particular, one of those actually was just highlighted in MIT News, I think literally today, which is some work that looks at machine learning approaches to take known drugs that are used for other things and see if they're effective at treating COVID-19, particularly in older patients, where even vaccination may not work as well because they don't get as much of an immune response from the vaccines. And that's where work by Caroline Uhler in the EECS department. So it's something that's been a big focus across the MIT campus. Jameel Clinic's been working hard on it, and there happens to be a result in today's MIT News.
Thanks, Dan. That's great. And I just add to that, I think, you know, the activity on campus when COVID hit, whether it was new ways to discover drugs or coming up with a very inexpensive way to make face shields, or an old project from a design lab to do ventilators, people just really turned to this quickly and really had, you know, sort of wonderful impact. And that's part of what MIT does, but it was great to see that. Steven, the next one for you, and then we'll go to one for all of us. An audience member would like to know more about how your work on genetics impact can illuminate how we should design or redesign protocols for various groups. And I hope that made sense to you. Can you comment on that, please?
Yeah, of course. This is kind of exactly what I hope to address maybe in the future that is however many years. Yeah, I think the first and foremost important thing is basically when we think about a study, how representative it is in terms of kind of, and certainly to also focus on the big question of, well, is this going to be relevant for whatever we're trying to predict? Because there's actually been this quite seminal paper published by, I hope I'm pronouncing his name right, John Ioannidis, and he argues that most of scientific research published so far is incorrect or irrelevant. And you know, it goes back to your question of, well, okay, is it because we're designing these studies incorrectly? I mean, a lot of the factors that lead to these incorrect findings come from basically, you know, things such as bias, and you know, and the bias can literally come from anywhere. It could be something as not as innocuous sounding as funding sources or anything like that. And I think really for things like genetics research, what we have to do is we have to ask, well, okay, who are we going to, or how do we kind of get a population of people that are representative of the diseases that we're really hoping to tackle?
Yeah, that's great. Thank you, Steven. I think that really it gives us a sense of where things have to go. So I'm going to now put up a question. It says for all speakers, including me, I'm going to use moderator's prerogative, and I may or may not answer it, but it's a great question. What's the role of ethics in each of your areas? And Dan, I'm going to start with you because I know, I mean, it's true for all of us, but the college, that's one of the, to me, the three pillars that the college is built on. But for Mariana and Steven, same question. What's the role of ethics in your areas? Dan, please.
Yeah, so as you said, Eric, in the Schwarzman College of Computing, one of the major focal areas is on social and ethical responsibilities of computing. And I think that it's hard to imagine the degree to which, with computing already so intertwined in our daily lives, how much more intertwined it's going to get with advances in AI that are currently happening. And that makes it imperative that we really think about a broad set of social and ethical issues. So ethics itself and issues of morality and so forth are extremely important, but there are, economic issues, political issues, legal issues, issues of inequality that aren't necessarily ethical issues in the sort of narrow sense of ethical. And so, we're really looking at the broad set of questions there around computing. And in particular, the fact that computing is transforming almost every discipline, which means that if we don't think about these social and ethical issues in computing, it's sort of like, it's spreading everywhere. And so if we don't get it right in computing, we're going to have negative impact as other disciplines start to rethink what they do using computing. So it's incredibly important, I think, in every area, but particularly given the role of computing right now, it's something we've made a foundational aspect of the college. And again, I'm just going to keep plugging things here. Next week, there should be something in MIT News talking about a new set of case studies that are coming out from the college in social and ethical responsibilities of computing. That'll be twice annually. And the first set of those will be being announced in the next week or so, with a set of 4 case studies about really applicable problems where you don't have to be a computing expert, you don't have to be an expert in that problem. And those case studies are intended to be used from the undergraduate level on up.
Dan, that's great. And I'm going to add 2 things, and then I want to get to Mariana and Steven. Again, the question is role of ethics. I'm sure you haven't lost the question, but just 2 quick comments, Dan, to add to what you said. One is, my perspective, the college, because of that focus on ethics and social impact, is bringing collaborations which were already in place, but strengthening them just across the Institute. Our SHAS faculty are interacting with our Sloan faculty, are interacting with our engineering and science faculty. And as you know well, Dan, one of the goals of the college is to hire some new faculty lines, including many that will be joint. And I know one of the searches underway right now. Do you want to say a word about that search in philosophy, Dan? Just a second.
Yeah, so we have a search in ethics of computing, literally in the technical sense in philosophy of ethics. And it's just been amazing watching that search process and watching the philosophy faculty and the computer science faculty and the AI faculty really come at these problems from a set of different directions, and the kinds of discussions that happen with the job candidates are really amazing. One other thing I might note about our engagement between computer science and AI and philosophy is not just around that search, which is extremely important, but in CERC, as we call it, because everything at MIT gets shortened, SERC for Social and Ethical Responsibilities of Computing. One of the first postdocs in the CERC program, a guy named Milo Phillips Brown, an MIT PhD in philosophy, is just starting a faculty position now at Oxford in philosophy. And so, we're starting to already be recognized as a place that's training great philosophers who also really understand computing in a way that most philosophers don't. And it's something that in the philosophy community is being viewed as more and more important. So it's really just terrific to see this as something that's important in computing and important in the disciplines like philosophy that we're working with.
That's great. And sorry, Mariana and Steven, but I wanted to get to that issue. But Mariana, same question. Role of ethics in your field, and how crucial is it?
Sure. And I appreciate Dan broadening it from ethics technically defined to questions of morals and justice. And so, what I'll say is that my work is motivated by the quest to eliminate health disparities, racial health disparities, and social health disparities, because I think that without justice in health, we cannot expect justice in any other outcome. So the search for the just city, for example, is fruitless if we continue to accept health disparities by geography, by race, by socioeconomic status. And I think that justice in health is a very unique and different. We have sort of our highest calling is to address the issue of health disparities, because health is what's going to underlie our capacity to do anything else we want with our lives, right? So I think that, my work is trying to point to the systems and structures, the policies and the plans that are creating unjust, preventable, disparities in exposure to health risks and in unjust and unfair and preventable health differences in health outcomes, and then saying, what can we do about that, and do it in a way that is ethical, working hand in hand with communities and having people who are close to the problem help shape the research questions, help shape the way the research is actually operationalized, help make sense of the data, interpret the data, and then tell their own story and put it into action in a way that they would like to use the data. So it really motivates everything that I do, and I really appreciate that question.
Thank you. It's great. Steven, thoughts?
Of course. Mariana, I really appreciate you kind of focusing on the idea of justice. It's kind of something I kind of sleep and dream and think about quite a lot, actually. And yeah, this is something that is obviously very, very important when we think about things like genetics research. I mean, we're already able to predict things within, or predict your height within an inch or so. So think about what you can do in the future when you can predict diseases. I mean, there's perhaps some entities who would love to know kind of your risk for disease, right? I.e., health insurance companies and so on. So then are we going to become, if we're going to coin a term here, like geneticists, and that obviously is a really deep down dark path. And of course, this is something that is extremely important for healthcare, for scientists, people like myself who want to go into that field. And that's why I think it's now more important than ever, for example, for scientists to also learn how to be good communicators. We've seen so much of a kind of disparity between what scientists are saying and what people are understanding in the public. Just the pandemic in general has really clearly demonstrated that. I mean, that's why, for example, I majored in writing, because I realized, I think early on, that besides my love for stories and movies and whatnot, and wanting to write, I understood that, as a scientist, I needed to do more if I wanted to make that science accessible to everyone I hope to kind of reach.
Steven, it's a great point. And by the way, it's why 15 years ago, we changed from a writing requirement to a communication requirement, because we agree with you, you need to do it. I've got some individual questions and we still have a little bit of time left. So Mariana, the next one is for you. The connection with the community where you considered the individual's approaches to healthcare is very interesting. And the question from one of our audience members is, how do you build trust? Does your team also put together approaches for doctors and clinicians to help communities and address individuals' fears and concerns?
Wow, that's a fantastic question. Okay, so I think the short answer is that you build trust by being trustworthy, and you build trust by continually showing up, being transparent, and coming with a posture of kind of horizontal peer relationships where no one person on the team has all the answers, recognizing your own blind spots, acknowledging the truth that other people's experiences hold. And I could go on and on about this, so I will stop that. But I think the key to building trust is by being a trustworthy partner. We're not the experts in how to build trust in a clinical setting. There's a ton of great people doing that work. I can put together some resources. That's not exactly what we do, but it's a wonderful question.
That's perfect, Mariana. Very well said, and I really appreciate that. Dan, I have a great question for you. Not that they all haven't been great questions, but we have a question from a high school senior who has just completed some computational biology research at a local hospital on cancer immunology, and who's inspired by MIT's work in machine learning and AI to develop cures. Are there suggestions you can offer about additional opportunities to pursue things in computational biology at MIT or elsewhere? What advice would you give to a high school senior?
I'm going to start with the very local advice, which is come to MIT and do a UROP. And that's my advice to most MIT undergraduates about the UROP side. But seriously, I think that to me, the really powerful set of questions are at the border of using machine learning in a variety of health areas, both for discovery and for clinical treatments. And in cancer, there's both a lot of research to be doing, but also a lot of clinical opportunities. And so I think that a place where you can, find people who are leading machine learning researchers, within AI who are also working on health problems. And at MIT, we do happen to be very strong in that combination of machine learning and health. But there are a number of other institutions, and I would look for, computer scientists working with health professionals, either biology, more translational biology folks, or people in medical schools on practical problems. That to me is really the best combination.
That's a great answer, and I'm sure most of our audience knows this, but for those of you who don't, UROP is Undergraduate Research Opportunities Program, a tremendous program at MIT where undergraduate students work on cutting-edge research with faculty, with postdocs, with graduate students. MIT.urop.edu will get you lots more details there. We have a few minutes left, and so I'm going to unfortunately, we're not going to get to all the questions, but there is a question for all of you that I think would be a nice way to try and wrap this up. And so for all of you, how do you think technology can be designed to avoid future outbreaks? Can it? Particularly in genetics, where we don't know what factors might have an impact on the results, and in AI, where we've sometimes have ways of thinking about it, sometimes we don't. But just generally, what role do you think technology could have in trying to prevent future outbreaks? And just because I've been starting with Dan on every one of these, I'm not going to this time. Mariana, I'm going to ask you to start, if you don't mind, just thoughts on this, and then Steven, and then we'll let Dan finish this up.
Sure. I mean, I'm probably the least qualified to answer this question, but I would say that we have to be cognizant of the fact that technological advances, even if on average they improve conditions for people, can also widen disparities. And so I think any technology that is intending to kind of mitigate the fallout from some future crisis or outbreak has to really take into it has to start from the position of sort of the most vulnerable users of that technology, and be developing and designing with those populations in mind, so that even if the technology is great on average, it's not also exacerbating disparities. So I don't have a lot of expertise on this, though.
But that's what, Mariana, it's a perfect answer, because it shouldn't just be the technologists answering this question. It needs to be people that think of it from just a whole range of perspectives. So I love your answer. Steven, thoughts? What role, if any, can technology play in trying to prevent future outbreaks?
Mariana, I argue I'm much less qualified to answer this. But yeah, if I had to kind of chime in my thoughts here, I'd say that, if we actually knew how technology would prevent a future outbreak, we'd all be rushing to that field. And it's kind of only a guess from here.
Yeah.
And in the same way that genetics research in a few decades ago, we never would have imagined we would have gotten here. I think that when the next outbreak does come, we will have technology to at least mitigate kind of the fallout. I hope that this past year has been a learning experience for everyone, and everyone has realized that scientists and engineers have a lot to offer, and that it's not some always an ivory tower where we keep kind of mixing solutions until one day a black hole is formed and everyone gets sucked into it. No, it's a lot of very well-meaning and very caring people who really want to make the world a better place. So I just hope that the past year has kind of taught everyone that yes, we do want to help.
Steven, a perfect answer, and thank you for bringing in a better world, because that's where we're all headed for. Dan, thoughts?
Well, actually, I'm humbled by both Mariana and Steven's answers, and I agree. I'm the computing technologist here, but I agree with Eric's observation at the beginning that these are questions that need to be answered very broadly and not just by technology experts. And that's, again, one of the things that we're looking to do in building partnerships in the Schwarzman College of Computing across MIT broadly, looking at these kinds of questions. I think that one of the really amazing things about machine learning lately in a variety of domains is its ability to look at large data sets and make predictions that experts are unable to do from the same data. And that is by itself a two-edged sword. And you certainly need to think about, when you're gathering lots of data and making predictions, you definitely need to follow what I'll call Mariana's rule of don't just look at the average. You have to look at the outcomes, particularly at the bottom end, and understand what's happening there. But one of the amazing versions of that is breast cancer detection, which now MGH is starting to use some work developed at MIT by Regina Barzilay in their actual clinical practice, because it can detect breast cancer much earlier than radiologists. And I think we have so much data about human behavior that I do think you could start using machine learning to predict behavior changes that might indicate early stages of a pandemic. It's a very exciting area, but one where we have to be very careful with what we're measuring and what we're doing with the data that we're measuring.
And I think this is a great way to bring it all together. And I would just add very quickly, because I'm getting the signal that we need to move on to the next session, but just to make, it strikes me that interdisciplinary is so important here. It is all parts of MIT working together to make this go. And I appreciate all of you with sort of wrapping that up. So thank you to the audience for some great questions, some stimulating questions. Thank you to Mariana, to Steven, and to Dan for some great answers and some great presentations. I know I learned a lot tonight. I'm sure everybody else did as well. To our audience, we hope you'll stay and participate in the next round of breakout sessions set to begin in just a couple of minutes. To find your next session, just navigate back to the event page and choose the session you would like to attend. Enjoy the rest of your evening, and please stay safe. Thank you.